We left off in very early 2005. I was fattened and weakened, but in remission. I ended up going on a low-carb diet, through which I lost all of the weight. That diet and weight loss continued through the entirety of the second bout of cancer, its treatment, and the remission after it, though. So treatment had wrapped up at the very end of January, the very beginning of February that year. In September, I started getting what I would learn were petechia, some unexplained and persistent bruises, and persistent bleeding, like I was not clotting and stopping bleeding. So I called the doctor's office, described my new symptoms, and they had me come in for blood work. And into the hospital I go, because now I had something new wrong with me. A super rare side effect of the treatment for the first cancer. I even remember when my oncologist was telling me about the side effects of the chemo I was going to be going through. There were 5 different drugs. She was required to tell me about this one, and even she prefaced with, "This one is super rare, but it is technically possible." 2 of them have the super rare side effect, I'm good at getting those, of secondary leukemia. Yeah, chemo can give you cancer, and leukemia, any kind of leukemia, is far more dangerous and deadly than the cancer I had. Well, the survival rates for treatment are certainly far worse. And they weren't in my favor in the first case. Leukemia is also a very different cancer from the sarcoma, the tumor I had in my arm. This is a blood cancer. What it does, what it means, is that my body stopped producing functional blood cells, which is why you become anemic, neutropenic, and thrombocytopenic. That means you don't have red blood cells, white blood cells, immune system. This was at the time when that "What's an Immune System" commercial was out, and I would laugh because it was true, and no platelets, hence the lack of clotting. So there are 2 ways to approach treatment for leukemia. The first one is chemo and a whole lot of hoping. And that's what we started with, because the alternative has a whole lot more hoping and a whole lot more potentially lethal side effects. Spoiler alert, the more extreme option comes later in this story. So the chemo was very different. It was 3 rounds of very different drugs for very different lengths of time. But at least temporarily, it worked. It put me into remission for a little while. A few other things that were notable and funny about my getting leukemia is the leukemia and the treatment for it kind of turned me into a vampire. I mean, I've always been very sun sensitive, and both made that far worse. I literally required the blood of others on a daily basis to survive. Being anemic does wonders for my already pale complexion. So, yeah, vampire, just a little bit. Now, finding out I had leukemia and the first treatment for it was pretty straightforward. And there wasn't much going on behind the scenes. That was the year I filed for bankruptcy, though. Previous bills, medical bills, and a profound inability to pay them makes that happen. Fun fact, that hospital in Reno, the one that was so troublesome before, the one that told me I had cancer and I could lose my dominant arm, was the first place to put me in collections. Yeah. So at least for a while, the chemo worked. It got me into remission. The scars for having had leukemia are very different from surgical scars, though I do technically have a couple from that. I have scar tissue on the back of my hip from all the bone marrow aspirations I had done. Now, a bone marrow aspiration is essentially drilling for a core sample of bone marrow. Bone marrow is where your blood cells are made and where they have to look to see if I'm actually in remission, meaning producing blood cells. Well, more specifically, no longer producing duds. So I've got a scar for that. I did also have pigment scars from being covered in hematomas. which were the large unprovoked bruises caused by an inability to clot. Those have mostly faded now, but for years I was leopard print in a rather easily observed by the naked eye kind of way. Part 3 is going to be far more complicated, and we'll get to it tomorrow.